Almighty God, none is like you. We are gathered here to celebrate your walk with us individually, your walk with us as entities, your walk with us as a nation. Indeed, for the last 15 years, Lord, you've walked with CHS in its efforts, Lord, to serve humanity in different capacities. And as we gather today to reflect on that journey and also look forward for another journey in partnership with you, Lord, we pray that you be with us throughout this forum to your glory only. A prayer of faith in the name of God the Father, the Son, and the Holy Spirit. Amen. Thank you. You may have your seat.
Thank you so much, Joseph. Let's give Joseph a clap. We appreciate you for taking us through that short session. All right. I want us to take some 5 minutes. I had asked us to look around the room and see someone whom you want to give a smile, shake their hand today. I'm hoping we have identified that person. It needs to be away from your table and not the regular, the person you work with. So, good. So the instructions are you need to, oh, people already waving. That's good. Yeah, you need to stand, walk up to them. I hope they are not a moving target. They may have identified someone. Yeah, but just walk up to them, give them a smile. Tell them, Karibu. Karibu to our special launch and engagement today. DJ, you can give us some music just for a short while as we do this. The idea is to energize the room a bit. Make sure you say hi and give them a smile. Tell them karibu sana, welcome, welcome. DJ, some music. All right, I see everyone doing well. All right, so at this point also walk to a second person. Yeah, and say hi. Tell them on behalf of CHS, Karibu Sana. So turn to your neighbor and tell them, Karibu, that was a good session. Karibu sana. And asante sana, I had that, yes, Karibu. Okay. So our chief guest, ladies and gentlemen, I now invite you to the beginning of our program. This morning we gather here as not just to mark a milestone, but to reflect on a journey that we've had, a journey of growth, a journey of innovation, impact, and many lessons. It is now my great pleasure to welcome Dr. Paul. Dr. Paul is our Chief Executive Officer. Let's give him a clap. He has not, Ajafika, is still passing the cake, taking the stairs. Let's sustain the clap, please. Karibu sana daktari. Yeah, he'll welcome us. Karibu doc.
Thank you very much for making time to join us this morning. It is indeed such a pleasure to see all of you, and thank you for honoring our invitation. I know we have here representatives of our donors. We have the Ministry of Health. We have some county folks. We have some of the corporates we've worked with and vendors that we've worked with over the years. And our auditors are also represented here. So really, thank you so much for making time to join us. Dr. Sam has done a great job in getting us to know each other. So my role today is just to give you a synopsis of why we are here today. There has been a lot of changes in our space in global health, but we wanted to take a moment to celebrate the work that we have done together, both colleagues at CHS, but all the other stakeholders, including our donors who have made this work possible, and also the vendors who have helped us meet whatever requirements we may have had for the work that we've done. And then I'll segue into a short session to just highlight some of our thoughts for the next phase. We know that a lot is changing. It has taken us time to iterate this strategic plan for the next period. So I'll give you a snapshot of what our thoughts are, and hopefully we can find ways of convergence to work together for the next phase. So without further ado, good, it's working. So this is what we're talking about in terms of our impact for the period. For any organization that works in public health, global health, once you work for a period like 15 years, really you should not be talking about outputs. You should be talking about impacts. And that's really what we want to share today. What have been our experiences and what have been the results that have come out of the work that we have done. It is great to remember that in 2010, I'm sure you've been given all little lapels that read 2010. In 2010, October is when we started our work as an organization. And we were working in 2 districts then. There were no counties. It was provinces and districts. So we were working in Thika and Gatundu, supporting 29 health facilities at that time. And it's amazing to think back that from there, we have been able to have a touch point across the country, across all 47 counties, and even beyond to other sub-Saharan countries, and have been faithful stewards of significant amounts of money, $279 million in this period, working closely with government, working closely with sub-national levels to get this work done. So we are demonstrating how we have acted locally to achieve global health targets. In HIV epidemic control, CHS has had work across 8 counties. We currently work in Siaya alone, but we want to remind everybody that yes, we actually did work in other counties and supported the achievement of Kenya's goal for epidemic control, HIV epidemic control. So, our first impact result to report to you, Siaya County, where we currently work, we've worked for about 10 years, was the first county to achieve actually surpass the HIV elimination target for mother-to-child transmission. The global elimination target was set at 5%. CI achieved 4.7% in 2024. And we believe that was work that was done in concert with the Department of Health in Siaya, but an important impact result for this period. The other thing that we pride ourselves in, we have counted all the babies that were confirmed HIV negative from HIV positive parents. 59,462 babies in the time that we worked from 2010. We also wanted to report to you that up to 10 million individuals have received a service from the organization across the board, whether it's a testing service, a prevention service, and of those who have been on treatment, the cohorts that we have managed have surpassed the 95% viral suppression target at 96% at the moment. So another important impact result that we are reporting back to you, our stakeholders. Siaya County has been quite a journey for us for HIV epidemic control. When we started working there in 2016, HIV has always been among the 5 high burden counties for HIV, and in fact had a HIV prevalence of 27% in 2016. What we have worked collaboratively with the Department of Health, with our donors for this work, CDC, and a lot of you in this room, epidemic control indicators, especially reduction in annual HIV infections and reduction in annual HIV-related deaths, have been achieved in Siaya County. We know that the HIV prevalence has also reduced because of identifying those who are HIV infected and putting them on treatment, and also reduction in mortality. So we are truly proud of the contribution of our organization in these HIV epidemic control global targets. The other area that we are truly proud of is tuberculosis response in Kenya. CHS has been a partner in TB response at the national level from 2013. In the period, we have worked together with the Ministry of Health, and the acting head of the TB program is here, Dr. Omar. We acknowledge you and the team at the National TB Program. Thank you so much for an amazing partnership. I think we have been our team has been embedded within the Ministry of Health's TB response over these years and gone through the ups and downs, and we're truly grateful for that experience. We know that Kenya achieved some of the UN high-level targets, targets for TB control. And those targets include, since looking at from 2015 data, declines in incidence and mortality. And this we've worked together with other stakeholders, but we know that we have been part of the team working on strategy with the TB program, working on policy, working on implementation support to reduce TB incidence by 46% from the 2015 baseline, and also reduce mortality by 58% from the 2015 baseline, contributing to achieving those high-level UN high-level meeting targets. Also, from the work we've done, and I'll talk a bit about diagnostics, 2.8 million Kenyans have received a molecular diagnostic for TB through the work that we've done together with now the Department of State and previously with USAID. And 1.1 million Kenyans have been diagnosed with TB, and also achieving treatment success rates above 89%. As you know, we've built capacity and worked side to side with them, and also built awareness in the community for TB, one of the oldest diseases, but still a problem in our country. So we are truly proud of the achievements in TB. And for this report and this meeting, we're only focusing on those that would be impact level results, although we know that there are many other results that we could talk about. Another important pillar to achieving these results has been the correct diagnosis for those who require it. I've talked a bit about molecular diagnosis for TB, but one of the areas we think has helped us move the needle has been ensuring we have access to novel diagnostics to the grassroots, to where the patients are. So we've been involved in various pilots for new diagnosis, especially for TB, like TrueNut, that has enabled decentralized molecular testing. We have also been part of the team that piloted the use of AI-enabled digital chest X-rays in 2022. I know right now it's been really scaled by various partners, but CHS was the first to look at how can this be done in real-world settings, and how can you model an approach for this. And we hope that those learnings, and we did share our learnings with the different partners as they were taking on the tool. We just hope that those continue being adopted. So, improving diagnostic yield from this radiology and this important tool for screening. And also, since the pilot, I think 80 of those tools have been scaled nationally, and others are still being scaled for this. For pediatric diagnostics, CHS was the first to introduce the stool-based gene expert testing for children under 5 years. And we know among children, because of postbacillary TB, very difficult to diagnose. And so we are proud of how that has helped move the needle for diagnosis among pediatrics. So I talked about pediatric HIV. I'll expand a little bit from our previous projects. We first started implementing in Central Kenya. I mentioned those two districts, Thika and Gatundu. Later, we supported the entire province. It was a central province. And then eventually counties within Central Kenya. So Nyeri, Nyandarua, Murang'a, and Laikipia as well. In that time, I think we had already got a taste of what it takes to reduce mother-to-child transmission for HIV. Because at the time when we were implementing Tegemeza program, that is on this end. Don't know whether my pointer can't. Okay, so the green, I hope I'm saying the right color. Tegemeza implemented in Murang'a, Nyeri, Nyandarua, and Laikipia. In 2017, mother-to-child transmission rate was 12%. By the time we exited in 2022, for the sites we were supporting, it was 2%. So we were really carrying those lessons onto the work that we've done in Siaya. In Naishi project, which was in Machakos, Kitui, Makueni, 2016 to 2021, mother-to-child transmission rate at that in 2016 was 5%, and we lowered that to 3% together with all of you here, preventing just under 9,000 of those infections. So the lessons from these two earlier projects, I think, helped us as we were implementing in a higher burden county in Siaya, and we were glad that those translated in the impacts that I have already mentioned to you. Part of the national TB response has involved many things. As I said, we've really embedded our work within the Ministry of Health with the National TB Program. It needs thoughts about strategy. It needs ways to monitor and evaluate and improve. It needs implementation of policy, translating evidence to reality, to real-world settings, making sure tools are accessible to those who need it. And I've mentioned the number of those we have tested, those with drug-accessible TB who have been identified. And also just to note that following the work that we did in the second USAID project, a review was done and it was determined that we should expand our work to implement in high-burden counties. So it is important to see, did that strategy work? Because that was a departure from the earlier grant that limited us to national level work. We currently do deep focus work in 16 counties that are high burden for TB. So we are pleased to note that in those 16 counties, these contribute 56, so more than half of the new TB infections in the country, in those 16 counties that are deep focus that we work in. Also, outcomes for treatment success surpass the others for those 16, 89.7 vis-a-vis 88.4. And drug-resistant TB treatment success rate especially, important to note that this is also higher in the 16 deep focus counties that contribute the majority of the TB cases. And we're truly proud of that, and that's what we've shown. But also importantly, because this is work within the same organization, and we know that TB is also a burden in Siaya County, especially because of TB-HIV co-infection, it was very clear for us to work together with the county TB program to improve outcomes for Siaya County for TB as well. And this is evidenced by achievement of a 73% reduction for TB mortality in Siaya County, which exceeded the national average. So we're truly proud of that as well. So I'll now move to another group of clients whose care has a lot of challenges, and these are the adolescents. Among the adolescents that we serve in Siaya County, and I think I should have presented that as well, when we started working in Siaya in 2016, and Dr. Kataka is here. Dr. Kataka, please stand. You've been leading this project for the last 10 years. Maybe you can talk about that. I can give you a chance to talk about that. What was the viral suppression rate in 2016 for adolescents, and how has that changed over the years?
Yeah, so when we started working in SCI in 2016, of course the overall viral suppression for the business people is the proportion of people you've identified and you are treating who have the desired outcome of a lowered viral burden. So the overall viral suppression was around 68%, for the general population. But this was worse among the younger population. So for adolescents and young adults was around 56%. And for children it was even worse, 48%. But due to the efforts, by all stakeholders, right now we are talking of overall viral suppression of beyond 96, as highlighted in this presentation, and even for children and the young adults, averages of around 95%. Yeah, thank you.
Thank you very much, and proud of the work that yourself and the team in CI have done. And we've done that through various strategies. There have been many strategies that we've had to iterate over the years together with CDC support, including what we call Operation 000, OTZ clubs, including differentiated care approaches, especially for those clients such as the adolescents. So, an example again of this is the DREAMS initiative. We've reached 63,000 adolescents and young girls who have been vulnerable to HIV with various interventions. But what is important to us, what have been the population level outcomes? And this is what we are reporting as impacts. So teenage pregnancy rate in Siaya declined in the time we've worked there from 23.9% to 17%. We've done the DREAMS program for about 5 years now. Am I correct, Kataka? Yes, 5 years now. Also, what has been important and another indicator that we have been tracking, new HIV infections among adolescents and young women in Siaya has dropped from 1.3% at baseline at project start to 0.6% at present, as we are now working to transition the program, which is a 55% reduction in new infections among this particular group. So, what were the other impactful things that remain sustained within the health system, which is important for the ministry to support the Ministry of Health with the objectives to make Kenya a healthier nation? We started working on improving data because of chronic illnesses and transforming from an acute care system to a chronic care system, which has really been the work that we've done together with our donors, CDC, formerly USAID and now Department of State. We started the journey of digital transformation in 2018, actually. And I think at that point, by 2019, we were the first, maybe the second to AMPATH in digitizing through electronic medical records health facilities. And we did 245 of those. And this has been important in monitoring outcomes. We are able to report these outcomes really because we have been digitizing the care of our chronic patients over the years. But probably the bigger platform is TB. TB is the TB surveillance platform that has enrolled over 1 million records for TB, and we were there from the start. Sri, who's here, Sri, you feel free to stand and wave. Among other, Tangazo Letu, Safaricom, and of course the team from the TB program. We were there from the time when we were starting to implement TB, and we are proud that now over 1 million records for TB are there, and there is routine monitoring across the country, and now enhancements have been made for TB to make it even more agile for epidemic control. Artificial intelligence for global health is a new area. I talked about the digital chest X-ray for early case detection for TB, and also precision predictive modeling for TB, which is another area that we think is novel, maybe not at impact level at the moment, but novel to help us get to the next step for epidemic control. And that's what I've talked about. We are working with partners to do predictive hotspot analytics and modeling through a connected ecosystem, because now within the TB program, we have a connected ecosystem for all diagnostics to help providers make the right decisions. And also we are currently involved in a pilot through TB Reach for the AI digital stethoscope that is part of a randomized control trial that we will be hopefully concluding end of the year. So universal health coverage, very important. We are proud to have been part of the team to pilot in the last, I think from 2023, integrated service delivery project, also funded by TB Reach, to answer the question, how do we integrate services within primary healthcare settings to support the universal health coverage approach for the country. This was piloted in Kiambu. What was interesting about this pilot, it was for TB and lung health, but also non-communicable diseases, is that from integration using point-of-care molecular diagnostics, we were able to increase TB notifications in the pilot sites by 31%, but also importantly diagnose other morbidities beyond TB, so lung health conditions, so asthma, COPD, and interestingly also non-communicable diseases such as mental health issues. So just as a pilot to demonstrate how should we make integration work within primary healthcare settings. But also importantly, even among the pediatric population where diagnosis is difficult, there was also an increase in case finding for TB. So sustaining the gains. From all this work that has been done, we have also been careful to ensure that we work side by side. We've always worked side by side with the Ministry of Health and county departments of health, but also capacity sharing, capacity building together. We have supported a lot of healthcare workers, and in fact, from the CDC awards over the years, up to 80% has really gone to personnel costs at health facility level through sub-awards to counties and for capacity building in the same space. And so we believe as transition happens, we've done our bit in supporting this capacity transfer. Though there's work to be done, to continue to being done, but I think it's been significant that over the years, it has always been an important marker. And in fact, we started the sub-awards for healthcare worker support back in 2013, 2014, actually, with the province in central Kenya and then later with the counties. We have also channeled the funds we've received to county sub-awards so that over the years they have been receiving a sub-award and we've been working together with them to manage the sub-award and get outcomes from them. I don't know whether there was a representative from Nyeri County, but we're really truly proud of even Nyeri County that we started doing this with before. Dr. Muriu gave an apology, but we would have been happy to hear his thoughts. Then infrastructure. So in the years where we were allowed to do some renovations, up to $2 million was invested in various infrastructure to expand space, to improve service delivery, and this remain at those health facilities for the foreseeable future. And also the equipment that I've talked about for various things, including diagnostics. As I said, we've been stewards of up to $279 million in public health funding. We have had clean and qualified financial audits in this whole period. And that's why we have had no problem inviting our auditors, past and present. So you can trust us. We have a track record that you can trust. And that's the first segment. And I'll now quickly transition to what we are foreseeing, what we are envisaging for the next phase of the organization, just to give you a glimpse of the thoughts. It's been quite iterative as things have been changing. And we know that even though we are planning for a longer period, iterations will continue happening. You wanted to?
Maybe
Chief of Party for USA Grant and other states. TV TV. She has Dr. Kataka Yuso spoke briefly. For the clean audits. George is what we see, coming next. We want to first acknowledge that the global health space has shifted completely. It has really not just changed, it has shifted. And the hard work that we've done demands that we become more resilient, more relevant, more influential. It means a financial reset for the organization because there's less predictable funding. It means their health system shifts. The government is moving quite fast with a lot of reforms in the health sector, because there's been numerous reforms and new capabilities brought about by new tools, especially those that are digital, those are AI enabled, and those become relevant in this next phase for the organization and generally for global health. So with this financial reset that has resulted in reduction in funding, value for money is central, and that's exactly what we want to focus on in the new strategic plan. Integration is accelerating within primary healthcare settings and for universal health coverage, but we really believe that local leadership still matters to make this work, because there are blind spots that may not be seen, that may be assumed until actual work starts is when they become visible. But more importantly, we want to continue to advocate for the fact that while we are making care integrated and at primary healthcare levels, there will be people who have been part of for a long period of time, and we are aligning with the government's approach, and how we can be more prepared for new pandemics, new epidemics, over time. So we see a way to design and institutionalize what works and continue being agile as an organization as we have been in the last 15 years. So we are proposing a couple of pivots. We would like to build our financial resilience, because I must say we truly believe in the work that we do, that it cannot just end. Whatever the case, we must continue being resilient, because for as long as there is need in the community, we must be there to support this and continue working with our existing partners and donors. From a disease-focused approach, of course, I talked about integrated health services and population health solutions for our population level. We've been an implementer, but we want to be a system partner now to innovate and for knowledge leadership from the experience that we've had. We also want to spread our wings a bit more to work with new partnerships across the region, and some of these are already happening. We are proud that Oram allowed Dr. Njeri to be here, so welcome. Oram is a South African company, and we will be doing some work with them next year. And from a traditional organizational model that we are used to a more agile, digitally enabled, and future-ready organization, we recognize that with reduction in funding, there will be difficulties in maintaining the status of the way we run the organization, but we want to maintain the expertise, and we want to be agile with whatever resources we may have. So we're really converting those pillars into these those pivots into these 5 pillars: building for financial resilience, sustainability and growth, and we have our corporate partners here that we'll be reaching out to. I saw a report about global giving index. Do you know the top 5 countries in global giving? Because now this is not about finances only, generally. I saw that and I was surprised that Kenya was actually second to Indonesia. That Kenyans give about 2.13% of their earnings or equivalent to others. So we know how to give. We need to harness that. Health impact and program expansion. So we continue our health impact, share our expertise for the new program approaches that are already there. Research, innovation, digital health, and knowledge leadership becomes important from the work that we've already done, to continue positioning for regional influence, partnerships, and growth, and then to be future ready as an organization in terms of our people and our operations for excellence. So we'll continue having agile talent, governance, and automation to lead the next phase. And that is it. Thank you very much.
Yes, let's appreciate Dr. Paul. That's good. Doctor, at this point, I would want to ask representation from the CHS board. A CHS plan is very strategic. So the board members who are present, I'm hoping Beatrice was here. DJ, give us some music. Appreciate Beatrice as she comes. This is a wonderful plan. Yeah, here you're just standing again with Dr. Paul doing that. Yeah, I appreciate this is a wonderful plan, and thank you so much. You can take your seats. All right. Let's give them a clap as they wait. Yeah. So thank you so much, Dr. Paul, for that wonderful session. We have come to appreciate the work that has been done. And with that good work, usually there is a story behind it. There are people, there are beneficiaries, and there is hard work that also goes on. So next, we will now transition into the documentary. This is just about 25 minutes, but it will help you give or get a background of the work that has been done out there in the various counties in the field. Over to you, the media team.
CHS has reduced the prevalence of HIV/AIDS. Without them, we would not have lowered it to single digit. CHS was formed at a time when grant funding was going to international agencies for good reasons, you know. There were no local organizations that could stand up to the task of being good stewards of resources and actually demonstrating impact from those resources. I think that's where CHS answered the question, because we could build systems within the organization to manage the resources, but also we could build expertise that work within communities, within health facilities to achieve the outcomes that were desired based on global standards. That's a question that CHS answered and opened the door for many other local organizations.
CHS is Centers for Health Solutions. So we are about health solutions. That's one. Two, in our mission and vision, we want to ensure universal access to health interventions through evidence-based solutions. So as an organization, I doubt there was anyone else who was better placed to respond to this bid, and we rightfully put in a bid, and we want basically to just achieve HIV epidemic control in yeah. So it's in our DNA. Health solutions.
When we started working in Siaya 2016, the prevalence of HIV was quite high, almost 30%. Because of reaching those who required a diagnosis, putting those on treatment to reduce mortality, you know, that prevalence now is just above 10%. One key indicator, which is viral suppression, was just about 60-70%, to now 96% for the population that we've been taking care of. And these are hundreds of thousands, you know, a couple 100,000 people. Like for the younger people, the adolescents, who have been much worse off and are generally trailing the adults, viral suppression for this group and the pediatrics was below 40%, 45% thereabout, and now above 90%. And we can't forget the 39,000 babies now HIV-free from the work that CHS has done.
I would say back in 2015, the MTCT rate, which is the mother-to-child transmission of HIV, was at 21%. So it was important that the mothers, number one, know their HIV status, so that the ones that are HIV positive, they're able to take medication so that they, you know, suppress, so that they do not transmit the HIV to their children.
Mimi ni positive, wanangu pia ni positive. Kuna watoto wawili na wote ni negative. Sister ameniongelesha, akanipeleka kwa ada. Sister akaongea na mimi nikamsikia.
Sasa changamoto nilikuwa nayo, nasema Mungu wangu, kama mimi nimejaribiwa na watoto wangu 4 nimekuwa negative, mbona hao wengine watoke positive? Sasa hiyo huwa inani-encourage sana, ambapo nikipata mama amepimwa wa kwanza na ameanza kulia ile kilio nilikuwa nayo, ninakufuata mpaka kwa nyumba. Kwa hiyo tumefurahia, watoto wako sawa, wako healthy, yeye mwenyewe ukimwona pia ako healthy. Hata mimi ukiniona na kaka mwenye na meza dawa kweli nisipatikane, hata anafurahi, naona kumbe hii kitu si kifo. And in 2023, Siaya County was the first county to actually achieve the global elimination rate of less than 5%. Siaya was at 4.3%, which is also a huge achievement for us as a county and even as CHS.
Looking at another challenge that is affecting Siaya County is the triple threat, where we have teenage pregnancies, gender-based violence, and new HIV infections. All these 3, if we don't address them, as much as we work on improving HIV transmission or acquisition, we might not be able to reach our goals.
The Dreams was doing a number of things to support the girls within the community. So these girls learned to be determined, resilient, empowered, safe. They learned a lot of things.
After I was registered, I remember sometimes they talk to us. Test za HIV, tulikuwa tunafanyiwa huko. Sometimes tukikaribia kwenda shule, nauliza kitu tunaweza taka, maybe itazo na books. CHS pia ilikuwa inatusaidia, ilikuwa inalipia fees. After I did my KCSE, I got a minor.
In my village, we saw there was a gap. Kama kuna event around, tungetafutanga viti na tents mahali. So we came out as a group, tukaamua, let's decide and apply for this. If it's going to be successful, itakuwa benefit for us. So we did it out, tukabarikiwa, tukapata viti na tent. In a week hatuwezi kosa 9,000. Tukicalculate na month, roughly tuko na 20 something hapo.
My diploma course was supported by Dreams. Yes. Hivyo tukaenda ambapo naweza sema Dreams ndio wamefungua macho yangu. Ndio maana hata niko kwa hii ofisi.
Siaya is also a cross-border area. We have a lot of borders around here. We have highways, the truck drivers transporting things along the highway to other countries like Uganda. So for key population, we have men who have sex with men, we have sex workers, then we have people who inject drugs, and we have transgender. Again, this population have been seen to have higher HIV incidence of even up to 31%, depending on which population we are talking about. They also face a lot of discrimination in terms of access to services.
Before nijuane na CHS program, unajua mimi ni MSM, and sasa siwezi sema life was normal. Kuna hiyo stigma. So kuna time ndio nilitembea kwa DICE, nikapatana na HTS, akanielezea services wanaofa, and because mimi ni MSM, nikakubali, nikapimwa, and naona ilinisaidia kwa sababu hiyo time nilikuwa HIV positive na sikuwa najua. Nilianza kumeza dawa haraka sana.
Vile CHS iliingia, nilikuwa naweza itisha condoms, naenda hotspots na wapatia. Lakini saa zile hata tujaenda nawaambia, kama mjaniona, you can just go to the office, condoms ziko, lubricants ziko. Mtu akiwa mgonjwa anaweza enda, ana explain ile ugonjwa iko nayo, madawa pia ziko. Mtu pia akipigwa UGBV, wananitafuta.
Kitu cha kwanza muhimu mzuri walinifanyia, walinieleza na wakanielekeza, ndio na mpaka wakanipatia vitu safe na njia mwafaka ya kutumia, ndio nikajua ati kumbe inafaa nikuwe na mixer yangu, nikuwe na needle yangu na syringe yangu, alafu niwe mwelimizi, nisiwe mtumizi mharibifu.
For the last 15 years or so, CHS has been partnering with the Ministry of Health towards coming up with various initiatives for TB programming. We have done this through 3 mechanisms, the first of which was the USAID-funded TB Accelerated Response and Care Program, that is USAID TB Act 1. Then we had USAID TB Act 2, and in 2024, we received funding for the current and ongoing Tamatisha TB program. And so the role CHS has played has been really to come up with various health systems towards strengthening TB systems. So CHS has been supporting 47 counties across Kenya with additional support for 16 deep focus counties.
The TB disease is a notifiable disease, and as such it means that we have to make sure data is collected, data is verified, and data is reported real time as patients are being diagnosed and treated. Now, most countries, actually including Kenya before, we used to do our data reporting through manual registers. Now, in the last 10 plus years, we have seen that evolve to a fully digitized system.
We also had challenges with the community linkage. By then, we didn't have a lot of the community health volunteers who were supporting TB. We didn't have the linkage assistant for TB.
So through their support, we brought on board our community health promoters and made sure that we have a lot of awareness creation going on at community level.
So they do screening in all areas of our service delivery points, and you find that no patient will come in with either of the symptoms and walks out or is being treated for another infection, and we miss.
Hii kazi yangu naona imesaidia kwa community yangu, sababu at least tunaona kama upungufu wa TB ama magonjwa zingine zimepungua, na pia tunawafundisha saizi wako na elimu kwa akili yao. Hata watu unapata mtu pia anajua TB ni nini, wanajua inaambukizwa through hewa, na wanajua kazi yetu. Hata tukifika kwa nyumba zao wanajua.
Mwanda mwaka kuja tukaongea na yeye, tukaenda huko hospitali, nikapimwa, nikaambiwa ati niko na hiyo ugonjwa, nikaandikiwa dawa. Kutoka hapo yeye ndiye alikuwa ananileteanga, ikiisha ananiletea dawa mpaka miezi 6 ikaisha. Sasa nikasikia mgonjwa nimeisha, na nikasikia nimerudisha nguvu yangu.
We have seen a lot of advancements in TB control. One such advancement is the introduction of newer diagnostic tools.
There was TrueNut MTB assay, which is a molecular diagnostic test for doing TB. Number 2, we had digital chest X-ray with computer-aided detection, basically the AI.
In addition to that, we also received IGRA. This is interferon gamma release assay. So we're able to test healthcare workers and check whether they've been exposed, they had the TB infection, and beyond that, what do we do with that information?
And then we also had a connectivity solution that we were revamping our laboratory information management system that we use for online reporting.
We really had to intensify our efforts to identify TB cases. And so we used the portable X-ray machine,
And this portable X-ray machine also contributed to an increase of the TB cases we identified. And therefore, when we identify more TB cases, we also identify more clients who require HIV care.
Kabla CHS ikuje, Mageta ilikuwa shida. X-ray watu walikuwa wanaenda Bondo, Siaya, lakini baada ya CHS kuja walikuwa wanakuja kama team. Walikuwa wanakuja wanaleta hospitali hapa Highland, hizo machines zote wanabeba, wanakaa hapa karibu wiki mbili, 14 days wakifanya matibabu hapa, kupima watu kifua, HIV walikuwa wanatest hapa. Ukipatikana umeambukizwa, unawekwa kwa dawa, unakuwa na kazi rahisi.
We had a lot of gaps. Samples were not reaching out for drug resistant surveillance to the national, which has a special mechanism or infrastructure with a biosafety level 3. So NTRL is the only public facility to carry out the drug susceptibility testing for TB.
So when I go to peripheral facilities, I collect samples like viral load samples, gene expert samples. We have DBS samples. Again, we have, not forgetting CD4. Those are the samples that we normally transport.
CHS came up with the One Health model. This particular model focuses on integrating animal and human health initiatives so that while these pastoralists are going through these animal health initiatives, they are also being screened for TB, for malnutrition, and for other diseases.
Wakati nilikuwa nyumbani, siliona mambo ya twins, mimi sikuwa natembea. Ugu sikuwa nasishika kitu. Sasa nilikagamba nikasema mbona sitembei? Mbona sishiki kitu? Hapo ndio imekuwa shida. Wakaniambia wewe kimbia Sigor. Sigor ndio wanakuokoa. Kufika hapa Sigor, madaktari wakanipima wakaniambia hiyo ni TB. Nikakuja Sigor nikakaa hapa. Nikapata matibabu ya kutosha. Na mpaka hapa sasa niko sawa.
Vumbua is a project that we've been running, meaning Discover. So we are going out to discover how integrated service delivery model could work when we integrate TB and other lung diseases, and also other conditions that are closely related to TB, such as mental health, malnutrition, and other lung diseases, such as chronic obstructive pulmonary disease, symptoms for asthma, and even symptoms for post-TB lung diseases at one go. Recently, we carried out a drug resistance survey as a country, and for the first time we were able to analyze TB using the TB sequencing machine supported by the CHS.
Kenya was among the few countries globally that had not only met the targets for reducing incidence or new number of people with TB and the targets for reducing deaths. For new cases, we reduced by 73%, yet the target was 55%. And for the deaths, we reduced deaths by 43% with a target of 35%.
We have also, through the various diagnostic innovations, are responsible for over 2.8 million Kenyans who've been tested for TB and over 1.1 million individuals who've been diagnosed with TB between 2013 and 2025.
We developed the country frameworks. Now counties are able to mobilize their own resources
But also we are now having what we are calling the transplanting, whereby we know when donors are not there and partners like CHS may not have money to support us, then we can continue offering the services that we have been offering to Kenyans.
The county is now standing on our feet. We are able to do this. That is as a result of that gradual, the capacity building, and building up our technical team in this partnership, so that we are able to do that.
The capacity that CHS has provided in terms of supporting human resource for health, which is a very critical pillar in the success of health management, not only in Kenya but globally. So CHS has done this in a very successful way, where we've supported more than 1,000 healthcare workers across all the communities where we have worked, managing their payroll and also building their technical capacity. This has enabled the G2G, the government-to-government funding and mechanism really to be managed fairly well, because we have had more than 30 audit reports, and none of them has really turned out to be negative. That has put CHS in a very good state in terms of even seeking for additional funding from our major donors, Department of State and CDC, including even private ones, because we have demonstrated the capacity to manage our resources.
Our bottom line is about saving lives. And when you save a life, there's no money that can amount to the joy you get out of that. And over these 15 years, we have had a touch point with a health intervention to more than 7 million individuals.
First of all, I feel very grateful to be working in an organization that has changed lives over the years. CHS have been doing good work in HIV and also in TB.
First, I congratulate the management and board of CHS for the continuity, because not many organizations make it to 15 years in this country especially.
We could say hongera sana, and you've done quite a wonderful work, which is actually very impactful. And it has not only impacted the patient, but has also impacted on the staff, on the healthcare workers.
Congratulations, as you turn 15, you've been of great help to the community, to us as healthcare workers. This far we have come, we've seen your contribution towards the betterment of our community.
We actually feel great as a Siaya County that we have partnered with a strong partner, with a strong donor, the funder USA government, and particularly the implementing partner that we have worked with in Siaya County. We would not have wished for a better partner.
Shukrani zangu zote nawapea watu wa CHS. Mungu afanye maneno ya kushangaza dunia mzima, CHS irudi.
Tuko na hopes juu hivi majuzi tulisikia kuna dawa inaingia yenye mtu atatumia mara moja kwa mwaka ama mara mbili. Sasa itasaidia ile uzito wa kutumia yale madawa.
I would like to tell the CHS, I will appreciate their support to the girls for supporting us in all the process that we've passed through, from health education to business startups to education substitute. It has been a lot to the girls.
Wenye wamesimama na sisi kama nyinyi,
Your foundation waendelee tu kuempower sisi. Kama wangekuwa tungekuwa hapa sahi, hata hawa watoto hawangekuwa hapa sahi.
Thank you. That was spontaneous. Asante sana. Yeah, that was really good work. I want to take just 2 minutes. It's my great pleasure to recognize the presence of Madam PS. Ameli Mudhoni. It's to see you. If you can just wave, I know you'll come up at some point. Thank you for gracing this occasion. All right, so very quickly, I would want to request the staff of CHS, if your staff, you can stand up. We just want to appreciate you for the good work you have done. And I want to request the following: Simon, Koki, Nyanya, Kennedy, Rose, Joseph, and Clarice just to come forward. DJ, give us some music as they come. They will represent the rest of the team. Yes, and continue clapping. These are wonderful people. You saw them speak. They've done a good job. Our media team, this is the time to take a photo of these wonderful people. You can do that thing of waving, as they, yes. Please appreciate them. It's just their moment. Wonderful. They represent the team here and those not here. Thank you so much. We can resume our seats. All right. Asanteni sana. All right. So we'll adjust our schedule a bit, and it's my pleasure to welcome Dr. Paul back to the podium so that he can take us through the next session. Karibu, Dr.
Thank you, Sam. Because of the time of our chief guest who is here, and we are truly honored and humbled with your presence, I think I'll hand over the program to the Ministry of Health, Dr. Gondi, to take over from this point just because of time constraints. Karibu, Dr. Gondi.
Thank you very much, our CEO, Dr. Kesa, Madam PS, State Department of Public and Professional Standards, the chief guest of the event today, distinguished guests from the USG government. I'm seeing very exceptional and very, very dignified members of the CHS team. We have county representatives who are here, friends and partners of CHS. I'm told even auditors are in this house. Ladies and gentlemen, good morning. It is my pleasure to welcome all PS to this event, and I really want to appreciate and thank her for getting the time. Given everybody who knows how things have been in the last 48 hours, she has the high energy exceptional. I'm very happy and proud to work with you, madam, and welcome to this event. I'll not say much as of now. I think I would want to invite, do we have the new representative who's in the house? Apologies. Then, of course, then we have the USG. If they are here, please, this is your opportunity to come and make remarks. Pardon? Oh. Well, we have, the pyramid is reversed. So, Madam PS is coming first. And as I invite her, Madam PS, I just want to paint a picture. These 15 years that CHS has been in the country, we used to work in some of these counties where they've worked. You could see actually disease on the streets. You could know that this one is unwell, this one needs to go for care. We would see children that needed help when they go to the hospitals without even waiting for the testing. Over these years, a lot has changed. And as from the cases that we have seen here, there has been impact in the 15 counties and other counties where we have HIV and TB. Kenya has made tremendous progress. We've managed to reduce the prevalence of HIV. We are working on the incidence of TB, and we've met our global targets on those, and we are on track to meet the SDGs in these areas. These investments, Madam PS, were led by government, but largely supported by partners, including USG, who are supporting our local implementers. And therefore, to that effect, I'm so happy that the right people are in this house today to celebrate with CHS as they celebrate their 15 years and look forward to how the future outlook is. And from what I've seen here, Madam PS, their outlook is aligned to your priorities. They are looking at more focus on primary health care. They are looking at how communities can be empowered. They are looking at health system strengthening. How do they partner and resilience and financing for their activities. So largely from what I see, we've worked together in those 15 years, but we have an opportunity also to move in this new dispensation arrangement. So with those very many remarks, I want to thank them, congratulate them for the 15 years, and it's my single honor now, a pleasure to welcome you to make your remarks. And as she comes, you know what we do?
We can
as
be
she comes,
and
as
give
she
her
comes,
a warm
please.
Thank you, Madam PS, for gracing.
Welcome, Sana.
Karibu sana. Thank you. We can resume our seats.
Please get seated. I think he told me to wave because today I don't look like Madam PS. I look like Mary, Mudhoni, Muso, all those names for the weekend. I want to truly apologize because of coming dressed very casually. I am actually on the move because I'll be traveling to Ethiopia for the regional meeting. But before that, I also have a small workshop to open, and then I'll be going. So I had to ask, where is the TB champion? I had to actually ask him, can you ask her if I can come dressed casually? Are you sure? Anyway, good morning. Good morning, ladies and gentlemen. It's truly a pleasure to see you this morning. And I'm always happy to meet with TB champions and generally people who work within the health sector. Today, we do not just gather to mark time. 15 years. I know it's a long time. But we are not here to just talk about the 15 years. We are here to celebrate the lives that have been saved in those 15 years. We are also here to think about the communities that have been transformed. He has said you could actually tell a sick person before CHS. You could tell, hey, this one needs care, needs rehabilitation, needs this and that. So the communities that have been transformed and also the health systems that have been fortified. So it is my really profound honor to stand before you this morning at these 15 years of impact products and launch of CHS. A few moments ago, we have watched the documentary of 15 years of impact. We didn't just see statistics on the screen, but we saw the faces of mothers, the fathers, the children, whose future have been rewritten because of the dedication in this room. Hearing the deeply moving remarks from our project beneficiaries, all the way from Nyeri County, from, was it Siaya? Siaya County, reminds us of the ultimate why. Public health is not merely about policies or clinical protocols. It is about ensuring, So public health is not merely about policies or just mere protocols, but it is also about ensuring that every Kenyan has the breadth, the strength, and also the opportunity to build a prosperous life. And these stories remind us of the profound truth that the numbers we report in our boardrooms represent the real mothers, the real fathers, and the real children breathing easier and living longer. So for 15 years, say 15 years, the Center for Health Solutions has lived up to its promise as a preferred partner for health solutions. You have stood shoulder to shoulder with the Ministry of Health, the government of Kenya, and our invaluable international partners, including the USG, WHO, because through pandemics, changing medical landscape, and everyday health challenges, CHS has been a pillar of resilience and innovation in Kenya's public health sector. I've heard you have champions. They have said, we want this one to stay. So I'm looking at Heidi and I know you know what to do, because this one has to stay. When you listen, as we want to listen, or we want to listen to the CEO present the 4th strategic plan, I want to see or feel the sense of hope. I haven't looked at it, but I'm just envisaging that it should reflect a sense of hope, and a strategy is only as strong as the heart behind it, and the heart of CHS beats the people of Kenya. If I may mention just a few statistics which I have read as I was given notes. I have seen a few statistics of what CHS has been able to do, that through the Unbreakable Partnership, we have redefined what is possible in the fight against tuberculosis. And between 2015 and 2024, your support has contributed to a staggering 46% reduction in TB incidents and a 58% reduction in TB deaths. Those are not just the statistics. I think it's a reflection of what is happening in the communities. How about we go to 70%, 80%, 90%? It's doable, you know? And we are seeing an 89.7% treatment success rate. So that means we have improved in our surveillance. We've been able to pick on the cases from the communities and push them to the facilities to ensure that they are treated and treated early. And that takes me back to our community health promoters, the kind of work that they are doing in the communities, ensuring that they detect any abnormality with individuals in the community and refer them early to the health facilities. Kenya proudly stands as the first of 6 countries globally to achieve and exceed the UN high-level meeting targets for reducing TB infections and deaths. So we are also very proud as a country because of the achievements. But the victory does not end there again, because in the fight against HIV, you have helped deliver a miracle to families across the nation. From 2010 to 2025, more than 59,462 babies were born HIV-free across 8 CHS-supported counties. In Siaya County alone, new HIV infection among children plummeted by 92%, and by 2024, Siaya officially reached epidemic control. We have achieved this by embracing the future, from managing over 1 million digital TB records through the TB system to pioneering AI-enabled digital chest X-ray for earlier detection. And CHS is helping Kenya build a resilient, people-centered, and technology-enabled system. Really, ladies and gentlemen, as we prepare for the digital launch of the CHS at 15 report, let us remember that the work of health is never fully or truly finished. You cannot say we are satisfied, we are okay. I mean, new kids are being born every day. They will get into the challenges that we face at community level. Issues to do with climate change has shifted, the architecture, the demographic, and everything, how we see things. Therefore, we can only say, or we can only pause to say, look at how far we have come. But also, look at how far we need to go. We are talking about 58%. I mean, we have not seen 100% in any. Therefore, we need to look at how far we need to go and look at the lives that we have touched before. Ladies and gentlemen, I want to thank you for even inviting me to celebrate with you. I want to thank you for the unwavering public health impact that has been seen. And I want to say happy anniversary. Off the cuff, I really want to appreciate the US government. You have been a great pillar and a great donor to the country, Kenya. And we have shown and exhibited that we are not taking matters health lightly. We have taken the bull by the horn, and that is why we have rolled out a very robust program, the universal health coverage. Never again do we want a person, whether a man, a woman, from any economic divide, suffer because of health issues. The out-of-pocket money that can be used or used to be used to buy drugs should go and buy food for the children at home. The laws that we have built on the Digital Health Act of 2023, the Social Health Insurance Financing Act of 2023, the Primary Healthcare Act of 2023, and the Facility Improvement Financing Act of 2023 is simply an indication of the seriousness or how serious we have taken matters health. And indeed, we haven't stopped there, because we also realized we've talked about commodities, we've covered issues of infrastructure, we have covered issues of data, but we forgot the patient. That is why we have another bill in Parliament today, the Quality of Care and Patient Safety Bill. We must reduce the way patients communicate their issues. Every other time, if you go to Facebook today, you'll see a video from a specific facility saying the way a certain healthcare professional did not treat me properly, complaining about the infrastructure. The patient must be heard. Healthcare professionals must be heard. And we must have a standard way of operating our facilities. Therefore, our regulatory bodies will have quite a bit of work to ensure that we have that. So in Kenya, we are on a pedestal, and we want to create this as a center of excellence. Not just in one aspect, not just in TB, but in all aspects. Whether it is in terms of digitization, health is highly digitized as we speak today. I don't know what is remaining But we keep on going, Kaizen, because you can never get 100%. The one thing that I will ask each one of you is that we must move away from more curative to preventive and promotive. As long as we are insisting on building infrastructure, buying equipment, and forgetting that at the community is where we can control, then we might mark time. So I also want to tell CHS, you have a new challenge. For you to get to 90%, go back deeper to the communities. That is where we must control. That's where we must prevent. That is where we must promote activities around public health. The other day when I was reviewing issues to do with Ebola, and I was told where we are scoring lowest is in the infection prevention control. And I asked myself, so we have been unable to clean our hands. We've been unable to tell people to clean our hands. I mean, it is the simplest of the things to do, but it is where we are scoring lowest. So let's go back. Risk communication. How are we impacting the lives of these communities through basic communication? Where there is no impact, sustainability, and visibility, we get a challenge. So in everything that we plan, in every program that we plan, please think about impact. Who is it impacting? How is the sustainability of this? And we must always bring on the table that which we are going. Asanteni sana, and have a beautiful, beautiful morning.
Thank you so much, Madam PS. Allow me to, I know you're moving very fast, asante sana. Madam PS, you can wave at the answer that I appreciate you. Thank you so much. And I would want to request you to just give me 10 seconds only, so that we can now move into launching this document here. I'd want to request Dr. Paul, Boston, Jennifer, Dr. Gondi, please come forward. Heidi, kindly. Amit, are you around? George, Dr. Kataka, Dr. Nkirote, please move forward. Beatrice, Dr. Njeri, please come. All right, so these are the quick instructions. We are going to have a 10 seconds countdown. So you must count loudly as we move to the launch, and Madam PS will be our lead. So you also have to be hard counting. All right, are we ready? My media team, are you ready? All right, it goes. So when you see the numbers, you count.
10, 9, 8,
let's go.
7, 6, 5, 4, 3, 2, 1.
A big clap. Awesome. CHS at 15, thank you so much. My team at the podium continue to wave and appreciate. Yes, continue clapping, continue. Thank you so much for blessing this occasion. Asante sana. Oh, okay, didn't see that coming. All right. All right, you can now gently take your seats. Thank you so much for your great support. Asante sana. Madam PS, I know you're moving quickly, so out there we have to adjust our program a bit and take some photos. So DJ, you give us some. All right. Back to you.
Thank you. I've been reminded that there are some people in the house that I didn't recognize their presence. WHO, please, Dr. Simba and team, you are most welcome to here. I have colleagues from Ministry of Health of TB program and syndemic disease control here in the house. Thank you very much for walking the journey with us and all the other protocols observed. Thank you.
Thank you so much, Dr. Gondi. Your guidance is well received. All right, so just a little bit music, and I stand advice with Madam PS. We want to take photos with you, even as you transition. So we'll start off with Dr. Paul and the board members and the leadership, Dr. Nkirote and Kataka and George. We can do the first quick, and then Heidi and Jennifer kindly also join the team so that we can take photos with Madam PS. You want to do it here? Oh, good. I'm in the hands of our communications team. Thank you so much for that wonderful session. Welcome you for this photo session. Dr. Gondi, kindly also join me. Dr. Kataka, maybe I stepped out. WHO, you can join in. I just wanted to add him to the picture also. Yeah, not to worry. Have you had enough? There's still one more we can take out here, but thank you so much, Madam PS. I know your time is tight. I think that's good enough for now. Madam PS, the staff have really requested also if they'll take a photo, but we can do it out here on the branded. And this can be a small break as we do the photos. Feel free to shake hands and smile again as we take photos. Oh, my colleagues, please come. just escorted Madam PS, and thank you so much for that adjustment we've done. This is a good moment to drink some water, clear your throat a bit. We'll need some help to bring back the podium. Thank you so much, Alfred. All right, DJ, you can still give us some music. Some of our guests are still out there. And that has been a wonderful session. So now it's my great pleasure to now welcome Jennifer on behalf of USG to give her remarks. As she comes, let's appreciate her. Let's give her a clap. Karibu sana. Welcome.
Asante sana. Good morning, everyone. I was just telling Dr. Hari, what an incredible, inspiring way to spend a Friday morning. This has really been uplifting and exciting. The bar has been set very high for remarks, so I'm going to do my best, but please forgive me. It's hard to go after Dr. Wekisi and PS Mathoni. But really excited to be here this morning and privileged to be here to celebrate 15 years of the Center for Health Solutions Kenya. So on behalf of CDC Kenya and the entire US government, I would like to congratulate the CHS board, the leadership, both past and present, and especially the CEO, Dr. Wekisi, for his incredible summary and optimism moving forward. The past and present staff, as I said, and everyone who's contributed to the organization's journey. I really want to recognize, too, the government of Kenya. It was so nice to have P.S. Mathoni here, Dr. Gandhi here, but to recognize NSDCC as well, the county governments who are here, WHO representatives. I want to recognize also, again, the staff who are here, and the communities here, the community health promoters, the community health workers. Even if they're not here, I want to recognize them for all the incredible work they have done. Just as P.S. Mathoni said, that is really the heart of it. And if we can get the community right, it will save us so much in efforts and lives. Today, as P.S. Mathoni said, today we celebrate more than just an anniversary. We celebrate the lives saved. We celebrate the families strengthened. We celebrate the health workers empowered and the public health systems that have been made stronger due to CHS efforts. Through their partnerships, their incredible innovation, their resilience. In the last year and a half, 2 years, it's really been about resilience. And it's just been so wonderful to celebrate after such a difficult time, a challenging time, but to see the optimism and the opportunities that have come out of that resilience. Because you all at CHS have such a commitment to better health outcomes for the people of Kenya. So let's just stop there and congratulate them on that. CHS represents the strength of local implementers, working with government, with partners and communities to really translate the science, the data, into better health care for all. The true value of the past 15 years not lies in the volume of services delivered, but also in the systems, the skills, the county leadership built to sustain those services. And so as we look towards making sure that healthcare systems are sustainable in Kenya, as we start implementing the health cooperation framework, CHS has such an important role to play, and I wish P.S. Mathoni was still here, but I know she knows this. The important role that you have to play in really making sure that we move towards self-reliance in Kenya and systems are sustained. I want to talk a little bit about CHS special partnership with Siaya County and the counties in general. CDC and US governments have really been working to build the capacity of counties, and CHS has been such an important part of that. Since 2011, CHS projects have translated evidence into comprehensive HIV and TB services in Kiambu, Murang'a, Nyeri, Laikipia, Machakos, Kitui, Makueni, and Siaya County, where they are still working and doing such great work. In Siaya County, Shinda supported comprehensive HIV prevention, care, and treatment across 119 facilities in all 6 sub-counties from 2016 to 2021. They've done incredible work there. And they continue to do this work with direct services in 2 sub-counties, but what they've done is expand Siaya County's ownership and their ability to do it on their own, and that is just so critical. The partnership has included optimizing HIV testing, comprehensive care and treatment, elimination of vertical transmission. We've seen the incredible data around what they've done to make sure that babies are born HIV-free. Such important work. They've made sure that we have commodities. They strengthen laboratory systems, and they've done that important work that you heard about today around TB and HIV integration and all the strength that they've done to make sure that the national TB program is strong. And we know that TB is the #1 killer of people living with HIV. So important, the new diagnostics that they've done to catch it early and make sure that anybody living with TB gets the treatment that they need. Again, saving lives. They've also done, as you've heard today, incredible work with information systems and digitization, which allows us to have greater efficiencies, which will allow all of these programs to be more sustainable. They've had incredible results that you've heard about today. The women, children, and adolescents that have benefited, you heard their stories from their own voices and in their incredible work they've done and how they've changed adolescents' lives, young women's lives, and families' lives, and that's such an important work. So as These interventions have been implemented. You heard about Operation 000. You've heard about the PMTCD programs. They've made sure that this life-saving work, that a mother has been supported to deliver an HIV-free baby. An adolescent has been connected to her peers to make sure that they are living healthy and strong, and that they have viral loads that are 0, and that the viral load suppression rate is in the high 90s from where it was before. So we want to thank you for those efforts. So behind every data point that you've heard, a family and community whose future has been changed by the timely work that you've done, and the respectful nature of that work, and the high quality of that work. Talked a little bit about the community, the county transition. So this anniversary really becomes at a defining moment. We talked about how 4 of the 6 sub-counties in CI have already been transitioned to county-led, and the handover of CHS supported services in the last 2 sub-counties, Bondo, and I'm going to say the other one wrong, thank you everyone, is planned for next month. And at that time, CI County will be fully leading their HIV program and the TB program that is connected with it. And that is due to CI County, to CHS. The CDC-CHS collaboration piloted the G2G arrangement in CI County. Lessons learned from that experience informed expansion to across all 13 of the CDC sub-counties, many of which are now leading their own programs, and all of them should be by 2027. So your work has had such tremendous impact, and as I said, will continue to have tremendous impact as we start operationalize the health cooperation framework, and we move to the HIV and TB program being fully led by Government of Kenya and the counties of Kenya. And so your work is far-reaching, far beyond CI County, far beyond the counties that you've worked in that I just listed, far beyond the CDC counties. It will really be transformative for the entire country of Kenya. And I have a sense the globe, as more and more countries are doing this work. We need to make sure some of this gets written up, and so that it can be transmitted throughout the globe. For the US government, a successful transition means more than just transferring activities. It means ensuring that the county has the systems, the workforce, the data, the capacity, and the resources to sustain quality services. Looking ahead, the immediate priorities are clear. No interruptions in ART, no interruptions in viral load testing. We need no interruptions in TB diagnostics that you have brought such innovative approaches to. We need laboratory systems and services sustained, and commodity supply sustained. We need clear arrangements for our health workers, and supervision and volunteer networks, and that continuity of the electronic medical records hosting, data migration, and facility-wide digital implementation. So the measure of a successful handover will be simple. Every client continues to receive the medicines, the tests, and respectful care they need without interruptions. And we really are so excited and feel so confident that CHS is leading so much of this work. So again, congratulations to CHS for all of you who have done this important work that will make sure that clients living with HIV continue to get that care that they need. I had folks to help me prepare these remarks, and they said, looking ahead, the unfinished agenda. But I like the way Dr. Okisa said it much better, the new opportunities that CHS has moving forward and Government of Kenya has moving forward. So although this has been a very challenging couple of years, we have seen amazing resilience come out of CHS and others. And as I've said, that resilience, that vision of new opportunities will really lead Government of Kenya as they start to implement the health cooperation framework. So we need to continue to strengthen pediatric identification and viral suppression, care for advanced HIV disease and NCDs and TB screening with the new innovative models. We need to make sure that prevention is there. We have lenacapavir here now in country. We need to make sure that's getting to the right women. We need to make sure that the maternal to child transition continues to be under 5%. But these are incredible opportunities that CHS can assist with the innovative methods and the approaches and the evidence-based approach and the caring towards individuals that has always been part of what CHS does. And we heard that from the beneficiaries themselves, what a difference that you've made. So in closing, we know that CHS will continue to lead and focus in this way. Over the past 15 years, you have meant that lives have been protected, mothers and babies are supported, TB diagnosis is happening and treatment is happening, and maybe most importantly, that counties increasingly are equipped to lead their own health programs. On behalf of CDC and the entire US government, I would like to thank CHS leadership and staff for all your professionalism, your amazing resilience, your national and county government colleagues for their leaderships, and the healthcare workers and the community teams, the volunteers, implementers, and clients for their trust and commitment. Your enduring contribution in Kenya will be measured not only by what is delivered, but also what the county can sustain and improve and finance on their own. So from USG, we really value this partnership and the people behind it. So I want to say a huge congratulations to CHS Kenya on 15 years of service, partnership, innovation, and impact. And here's to another 15 years. Congratulations.
Thank you so much, Jennifer. I want to give you a symbolic clap on behalf, now that you represent USG. You worked with us, so we'll start with one finger. Tap it, 2. It's gaining momentum, eh? 3, 4, 5, 5, that's 15, eh? Drop it hard. Thank you so much. We appreciate you. All right. So next I'll welcome Boston on behalf of WHO to give his remarks. Give him a clap. Karibu sana. I remember the last time we met was when we were discussing vaccines, but Karibu, welcome. Thank you.
So, the CEO, is it Dr. Paul or Dr. Wakisa? Oh, both. I was confused. All right, but development partners and representative from the CDC and US government, media constituency, ladies and gentlemen, good morning. I've forgotten the word. Is it hamjambo, hatujambo? Hamjambo. So I am excited to join you today in this important occasion as you are celebrating your 15th anniversary. And congratulations, 15 years is no mean achievement. Kenya has made significant progress through partnership in health. And I know CHP has contributed a lot through all these achievements that the country has made. Just allow me to mention some of these achievements that the country has made through partnerships. 1, reduction in the burden of HIV, TB, and malaria. And we could see here the impact that CHP has made in this. Improvements in maternal, child, and newborn care with reduced mortality rates. Achievement of high child immunization coverage for vaccine-preventable diseases. Improved capacity to detect and respond to public health emergencies, epidemics, and health security threats such as COVID-19, Pundibujo virus, malaria, dengue, etc., etc. Improved detection and management of non-communicable diseases, and enhanced quality of care and service delivery at health facility level. Sustained availability of health products and technologies. Prioritization of local manufacturing of healthy commodities as a critical agenda in the current strategic health conversation, but also we are talking about also strong institutional capacity and institutions such as National Public Health Institute. Several milestones have also been made and realized over the years, such as enactment of legal framework to support universal health care agenda and to institutionalize primary health care. The country is also rolling out a robust social health insurance scheme that is managed by social health insurance to stop catastrophic out-of-pocket health expenditure by households at community level. The MOH and Digital Health Agency also is digitalizing Kenya's health data and information systems by scaling up its flagship Taifa Care electronic medical records system for efficient patient and hospital workflows at all public health facilities. WHO acknowledges that these achievements have been made possible through collaboration of many partners, such as three-level WHO, the UN agencies, developmental partners, including NGOs such as CHS, who have played or contributed significantly, as we have already seen also in the video that you showed. WHO Kenya appreciates the adoption and application of its evidence-based global guidelines, recommendations, and strategic framework across all health initiatives, and encourages organizations like CHPs to scale up innovations within this guidance as they roll out implementation of approaches and intervention in its new 2026-2030 CHS strategy. Ladies and gentlemen, despite the progress made, we must also acknowledge the existence of several challenges, including shrinking donor funding, an expanding youth population, emerging biological threats from communicable and infectious diseases, including antimalarial and antimicrobial resistance, emerging invasive vectors, and the impact of climate change on healthy and the rising burden of non-communicable disease. In addition, whereas there is a high enrollment into social health insurance, public voluntary contributions have remained low, thus continuing to create reimbursement pressures. The regulatory environment for healthy products and technologies also remain challenging. However, these issues are being ably addressed through ongoing measures to strengthen oversight and ensure access to safe, quality assured, and effective products and technologies. Picking a line from just ended Kenya Health Summit theme, reforms delivered, health is a right. We must all work together as partners in health to support the government to deliver on the best health outcomes for all Kenyans, as we observed what happened in Bondo by CHP. Let us build a strong partnership to facilitate Ministry of Health and related sectors to surmount these challenges and to sustain gains made and to achieve its health goals and targets. Colleagues, join me in congratulating the CHS Kenya during its 15th year anniversary celebration and at the concurrent launch of its next strategic plan 2026-2030. I like what the CEO mentioned about local solutions for global impact. I think this is what we need, because many times local solutions are tailor-made to the needs of the population that we serve. They put into the context the population that we serve. So ladies and gentlemen, with these few remarks, allow me once again to congratulate you, CHS, for the job well done, and thank you, asante sana.
Thank you so much, Mr. Mzimba, WHO representative Kenya. Boston, I wanted to appreciate you. You've gone so fast. All right. All right. So WHO, really wide, eh? So we'll need to measure it wide. Use my SOP. Are you ready? Are you ready? One, drop it. Thank you so much. We appreciate you for your kind remarks. Asante sana. Next, we'll have Naomi as a beneficiary representative. Naomi, give her a clap. Naomi has gone through quite a bit of experience that she's going to share. She has not arrived. You cut it short, eh? All right. Karibu sana, Naomi. Back.
Good morning. Good morning once again. All protocol observed. My name is Naomi Wanjiro. I am standing here today to appreciate CHS. as a beneficiary. One, I'm a healthcare worker, a nurse to be precise, and I am a survivor, a TB survivor, that is MDR. And I have walked this journey with CHS, and today I am very grateful to see 15 years. When CHS was starting, I saw them grow, and what they did to us, it is still impactful. I would want to say I'm also jealous because they left us and they went to another county, but I'm grateful the impact they did to our community is very, very felt up to date. CHS came when stigma was very high in Nyandarua, and I can attest to you that through the capacity building that they did to us, I being a healthcare worker, I was newly from the school, so I was posted in CCC and TB clinic. I didn't know anything about TB. I didn't know anything about CCC. I used to believe that TB and HIV, it is a disease for others. It is not for us healthcare workers. So it is through the capacity building, it is through the mentorship they did to us that we were able to manage our client and to put stigma aside, to bring the community around, to empower the community to take health to their hands and to know what it takes to be HIV positive and to get TB and to get healed. CHS, they have also done a very good job. This one I'll not stop to see. They built a very beautiful CCC in Engineer. Not only in Engineer, in other places, but I am speaking from where I am standing. I am sitting. We have a very beautiful CCC. Even though nowadays we are doing integration, the CCC itself has now been combined to integrate with other condition NCDs. So the CCC that were built, they are still working. We have the laptops that we still use. At times we laugh because when you go to see other facility, you get a sticker on the laptops, on the chairs, on the overhead lamps that they provided for us to do the cancer screening. I don't know what to say. I'm just grateful. I am standing here. They say if a building has to go very high, the foundation has to be strong. We have gone this high, and we are able to take care of our clients because of the foundation of the mentorship that CHS did to us. Thank you so much. And I'm not speaking for Naomi only. I'm speaking for all healthcare workers. Even those that have gone to retire, sometimes they call and ask, CCC still continues, and we are grateful. I'm also a TB survivor, and I got MDR. And I'm telling you, there is nothing that can kill you. The disease itself cannot kill you, but stigma. So the moment I got TB, I was very sure, CHS, they will lay me off. Because now you've gotten TB, you are not going to be of any help to us. Imagine they didn't. For 1 year I was bedridden. They continued to give me something. Thanks to them that I was able to take care of my children. And with that, I knew so well that they are walking their talk. When they say they are fighting stigma, they did it to me. They embraced what is called human rights. Thank you so much, CHS. I am also an award winner. You know, after I got TB, I went to India for surgery. For 1 year, I couldn't get out of bed. I was using even Pampers. But fortunately, I was able to go to India. A surgery was done to me, and I came back, and I got cured. Fortunately, I was able to go back to CCC TB clinic. Up to now, I still attend to my client. That is my specialty on HIV and TB. People laugh at me and tell me that, wewe na TB, you are one and the same. do I care? If the client get cured, is it not our happiness? So it is not just a case. It is a drop in the ocean, but I can tell you, my life was saved because of CHS. Thank you so much, and be blessed. Lastly, the buildings that were built. Sometimes integration is coming to tell us we abandon them. I don't know if anyone is around who works in those TB and HIV clinic. You know, and especially adolescents, just imagine a client is newly tested today. An 18-year-old client gets tested and HIV positive results come back. And you tell that client to follow the queue. It is unfortunate because the client will not go through the psychosocial support to understand, to share the story. Like for me, we used to have a lot of psychosocial through the support of CHS, where clients would come, sit together and share their stories. Please, please don't allow that to die, because it is through that psychosocial that the client are able to share their story, to support each other, and to walk the journey. That day it was me that people are saying Naomi is dying of TB, but here I am. I walked the journey, I was supported, and here I am, and I'm ready to support others. So let the psychosocial support not die. Also, the CHP, they are really doing a very good job. Even though they are not going to diagnose the condition, the fact that they will note that there is something wrong and refer to the facility, that is a very positive impact. For me, I got an MDR condition. At first, it was normal TB, the first line TB. I took the treatment, and in between, I went and I was told that it is MDR. I'm very grateful to CHS because they are bringing those new technologies. In fact, today in our facility, we have an AI that you get immediately, and through our phone, you get the result of a client that he or she is suspected, is a presumptive TB client. Immediately you send the client for gene expert. Things have really improved. Down 15 years is no joke. We've really walked that journey with you, and I'm happy to be part of it. Lastly, I forget a lot. This one is personal thing, something that I've noted. Anti-TBs, I took anti-TBs for 36 months. First, because I took the first line. Then after 2 years, I was told that I have MDR. The MDR drugs are so many. So I was choosing what to take and what not to take. The problem with healthcare worker, you treat yourself. You don't wait to be treated. So I was trying to avoid so many drugs. Unfortunately, I was being prescribed to take 2 tablets of pyridoxine. So I was just saying, hakanika vitamin. I couldn't take it. Now I have noted that pyridoxine was really helping. When we are giving our clients treatment, we tell them take the treatment and plus the pyridoxine. This pyridoxine prevents the numbness of your hands and the legs, for those that have seen that. But unfortunately, I was telling myself, I'm not feeling any numbness on my hands, I'm not feeling on my legs, so I will not take this pyridoxine. Unfortunately, the neurons on my brain, they are the ones that were affected. So saa zingine tunaweza salimiana, I forget who you are. So that is a problem that I have noted, and I'm really working on it. I'm trying to take some supplements to see if my memory will come back. Thank you so much for giving me that time, and all the best, CHS. And if possible, we are waiting for you in Nyandaro. Thank you so much.
Oh, Naomi, a good friend of mine. Please, you want to do that thing of... Please, yes, thank you so much for sharing your story. You need to say that Coach on thing. The award.
Through CHS, they nominated me for an award that was being called in the whole world. And I'm telling you, I was one of those that got the Cochon Award. And you know, an award comes with something. So it has really helped me to go openly to share my story with my clients and my community, and to put something small for my children. Thank you so much.
We appreciate you, Naomi. Asante, asante, asante sana. All right. That brings us to the end of our remarks session. DJ, I need some soft music now, since we want to recognize the support we have gotten from our donors. I would like to request Dr. Paul to come over, which is you can also join me. Is really ready with something there. I'm standing right in the middle. Heidi, you need to Dr. Nkirote will hand over this to Dr. Paul. So the instructions is that we have something really nice here. It's for you to open and see what is inside after you receive it. Yes, let's appreciate. We appreciate you so much for the support and working with us. I will let you get surprised with what is inside, and you can also read it. I can hand you a mic. Heidi, you said something I didn't hear.
I need my glasses to read it. Sorry. No problem. Oh, thank you so much. So I know that Jen spoke on behalf of all USG, just really appreciating the collaboration with CHS. CHS has been a tremendous partner, I think a shining example of a local partner and the impact you've had. I don't want to repeat everything that everyone said, just it's an honor to work with you and the team, and just really appreciating our partnership. You know, just in the past couple months when we asked you to make a lot of different shifts and respond to Ebola and everything, you've just been a really tremendous partner and always willing and always rising to the challenge. So just huge appreciation, and thank you so much. Thank you.
Thank you. Thank you. DJ, give me some music there. All right. Oh, thank you. Thank you so much. Let's appreciate Heidi, U.S. Department of State. All right. Yes, Dr. Paul and Beatrice, the assignment is still ongoing. All right. So next, I'll welcome Jennifer. A big hand, a big hand. And I'll welcome Dr. Kataka to, Jennifer right in the middle, so that, all right, good. You can give Dr. Paul, you can hand it over to Beatrice. Yeah. A big hand, a big hand. All right, you can go ahead and now open it and also see what you have there. And maybe you can also say something.
Just lovely. CDC has really appreciated all our work for so many years with CHS. I want to recognize Dr. Paul for recognizing me at Kisumu Airport many, many years after he had last seen me and calling me out and the important work and reminding me of the important work CHS has been doing. We've been actually working with them for so many years, almost since the beginning. And as I said in my remarks, just incredible leadership around getting government of Kenya and Kenya to self-reliance. So you guys were so ahead of the game, so far in advance of USG and our approach to how we do HIV. So you guys are truly visionaries, and we appreciate all the work that you've done. Thank you.
Thank you so much. I think we are done with that section. Let's give them a big clap, a big hand as they take their seats. Are you ready for the cake now? I didn't hear you. Are you ready? Yeah. I have cake matrons. The cake matrons are ready. So to handle the cake, I'll welcome Boston, Heidi, Jennifer, Dr. Njeri.
Just wait a minute. Okay. Good morning. Yeah, so it's now time to cut the cake to celebrate two important milestones for CHS, which is the 15 years of public health impact and launching of the 4th strategic plan. So the cake is a symbol of our shared work, both donors, implementing partners, the government, most of whom have left, the county government, and also our beneficiaries, represented here by Naomi. She's also representing healthcare workers. And it's showing, we are going to share the cake to demonstrate how we work together to achieve the impact that has been shared by our CEO, and also to demonstrate the growth and looking forward to a sweet future. The cake is sweet. Yeah, so our future is going to be sweet. And Dr. Jennifer has promised us another 15 years. So those 15 years will be sweet. On a light note, they'll be sweet, so we are looking forward to them. So as we cut the cake, let us reflect on the journey that we have taken so far together as a team, as we are here representing various organizations, and look ahead at what we are looking towards through our 4th strategic plan. We have achieved much, but as Madam PS said, there's a lot more to be achieved because we are not yet at 100%. And we look forward to achieve this through our 4th strategic plan. So DJ, you can give us a song as I call upon the following representatives to come up front and help us cut the cake. I'll start with our host, Dr. Paul Wekesa. Dr. Nikki. Okay, Dr. Paul has nominated Dr. Nikki. Okay. I don't know if there's anyone else from the national government or county government in the house. I see most have left. Anyone from the national or county government? If you're here, I haven't seen any remaining. Yeah, and then I'll call upon Naomi. Naomi is wearing 2 hats. As a healthcare worker, she has shared the impact at her facility and also as a patient, how she benefited from the CHS work. Oh, yeah, NSDCC representative, please come. Thank you. Then we have the one that had been called by Dr. Sam, Heidi, and Boston, please come and join us. Dr. Njeri from Oram Institute. And finally, Shri from Iridium. He has left. Okay. All right, so we need a representative from the corporate world. Yeah, and Dr. Jennifer, please join us. So we need to find space around the cake. Yeah, since we need to cut the cake, so we need to be close to the cake. Yeah. Yeah, let's have the song. We can be clapping alongside the song. Clap slowly, like, yes, to the beats. Dr. Kachaka, we are clapping. Woo! Okay. All right, so. Yeah, so we are now cutting the cake. Come up.
Let's give that a clap. That's another one. Good, good, good. A round of applause. I'll hand over back to the cake matron. So how do we divide the cake? All right, so the cake is coming to a place close to you. Yes, on the table. All right, so I'll need some help. My colleagues, please move closer so that we can move this faster. DJ, continue to give us some music. All right, so I'll allow the cake matrons to maybe put just 2 tables and then the rest can continue as I prepare Beatrice for a vote of thanks. Beatrice, you can just see, yeah, that one has arrived. The next one, next table, then you can come over. DJ, we can bring it down a bit. All right. Yeah, that's good. Yeah, karibu. Let's appreciate Beatrice on behalf of the board as she comes over to give a vote of thanks. All right, over to you.
Good morning. Good morning once again. Okay, I'd like to give a vote of thanks to our chief guest who has left, PS Muthoni, Public Health and Professional Standards, representatives from the Ministry of Health and Government of Kenya, county representatives, our partners from the World Health Organizations, our friends and funders from the United States government, fellow members of the board, they are not here yet, our CEO, and the entire CHS team, distinguished guests, ladies and gentlemen, good morning. It falls on me, on behalf of the board of Center for Health Solutions, to say thank you. It's a happy duty because this morning we've had a great deal to be thankful for. To our chief guest who has left, thank you for the keynote and more importantly, the partnership it represents. CHS has never worked around the health system. We have worked inside it and alongside it. And your presence today affirms that. To the Ministry of Health, who are still here, and our county partners, particularly the counties that have been mentioned, thank you for trusting us with your people's health and for holding us to a high standard while doing so. To our donors and technical partners, the United States government, thank you for the 15 years of confidence and for the resources that you have entrusted and to the lives that have measurably been changed. The report we launched this morning is in a real sense your report too. To our CEO, Dr. Paul, and the CHS team, you are the reason for us being here, and you're the reason there's anything to celebrate. 15 years of impact is not a slogan. It is thousands of ordinary working days in clinics, in communities, far from this room. The board sees it, and we say thank you. To Dr. Paul Wekesa, thank you for taking us so clearly through the impact report and for the 4th strategic plan, which we have all been a part of as a team. And to the team behind the documentary, thank you for reminding us what the numbers actually look like and the people's lives. And to every one of you who made it and your time this morning, we thank you. A 15th birthday is worth making, but the strategic plan you have just seen tells you where our attention really lies on the next 15 years. Thank you, thank you, thank you. Asanteni sana.
Okay, Beatrice, you went so fast. Faster than. All right. Let's prepare, warm our hands, warm our hands, warm our hands. Beatrice, this is yours. You'll receive, eh? All right. Measure. Again, drop it. Please pass it to Beatrice. Thank you so much. All right. Some music a bit. Kidogo. All right. Good. So our next session, and thank you, DJ. All right. Our next session now is to take photos, many photos, to show that we were here. But you also have an opportunity to network. So you can look around now again and see who are these people you want to say hi to, exchange numbers, talk again. This is your moment. I hope everyone has managed to get some cake. The cake matrons are still busy. All right. So we appreciate you so much. I don't know if Dr. Paul has any housekeeping. Again, maybe you can just wave and say thank you, thank you, thank you. Wave to them. All right.
Yes. It's not to take it for granted that you spent your time this morning with us. Truly grateful for your time, for your partnership, and we'll be coming back to you, knocking on your doors. Please open those doors. You have seen that we are a partner of impact, and we have the experience to show. So thank you very much. Enjoy yourselves. There's still breakfast if you'd like some more coffee. There's time to interact and network. If I haven't said hello, let me make sure I do that before you leave, and look forward to a bright future together. Thank you.
Thank you so much. So my wonderful colleagues have some things in their hands. Just remain seated for 2 minutes only. They'll pass by your table and just drop close to you as we have some music from the DJ. Rose, karibu. And we can do it in the next 2 minutes. Yeah. So as we do that, after we've completed that, we have a rotating photo booth right there. You can engage with it, take a photo. Right at the door also, there's a branded background for you to engage. Here also you can take some photos. Feel free. And thank you very much. My name was Dr. Sam Muga. It was my pleasure to be your MC today. Thank you. All right. Can I request a group photo for those who are ready? Feel free to come over to the podium. The comms team have advised me that group photos can be done from here. So yes. All right. So the place is being arranged. So if you're ready, please just come over to the podium and then we can take the photos. My comms team, please help me to move this so that we are ready. We can have the first batch, yes. Feel free, karibu. George, you want to join the photo? No, all right. Please join us. We can start in order of tables. The comms team are ready. Karibu. Naomi and table, please come. Karibu. Alfred, click away, click away. All right, so we are doing a serious one, right? Corporate and then fun one. 2 photos. All right. Are you ready? So the SOP for the fun photo is just putting your hand, yes, like that, towards the middle, All right, good. Okay, comms team, are you ready? All right, so I need additional team members to join the photo. Yeah, everyone, so that we save on time. Please join in. Doc. I need some, yes. Some more chairs. Fun photo, thumbs up, thumbs, thumbs. All right, thumbs. That was a serious one. Thank you very much, everyone. We can continue with our networking. Asanteni sana.